Hey guys, this is my 6 month video. It's been 6 months to the day since I had my microdiscectomy, and I feel really good. I am doing everything I want to do outside of some strenuous sporting activities, which I hope to be doing later this year. And I just wanted to give you an update. I took some notes for this one. That way I can get through without blabbering too much. I thought about the first 3 months of my post-surgery experience and what was important to get me through that. And first of all, medication. They give you a lot of pills, pain pills, things to help with the nerves while they're healing. Take those. You will need those. And patience is probably the thing that runs for the top of the list as far as importance goes. You just have to be patient. It's a slow recovery, depending on how long you were injured. It can be even slower and discouraging, but just stick with it. During those first 3 months, I think walking was the most beneficial thing I could have done. I know everyone has limits as far as how much they can walk during those first 3 months. I know I did. But just get out there and meet those limits. Don't exceed them. Don't put yourself in a bad position. But definitely stay active. It's huge. And physical therapy. That was really important for my progress. I can really remember the first 2 weeks of physical therapy being one of the biggest steps I took in my healing. So they focus on core strength, flexibility, just getting your muscles activated again. It's so easy to kind of forget how important that part of the recovery is, but that was the biggest step for me. And it gets monotonous, but just stick with it. I think I had physical therapy 3 days a week, and yeah, that was huge. And I learned a lot. I learned a lot about strengthening my core and strengthening my legs from that experience. So the first 3 months was really just about patience and being active while you can, physical therapy, and not overdoing anything. You are damaged goods at that point, and you just want to do your best to get better and not take a step back. I think months 4 through 6, it was all about core strengthening for me. I remember my surgeon telling me I was going to have to essentially work on strengthening my core every day for the rest of my life. And although that sounded like an exaggeration, I actually don't think it was. I think that is key. And find a routine. I try to work out at the gym 5 or 6 days a week now, even if it's for a half hour, just to do my stretches that I learned in physical therapy. That routine is important. I can tell when I miss a day or two, I'll start to feel some of the pain creeping up sort of in my foot or my leg, and that's just not good at all. Months 4 through 6, you should, and everyone's on a different timeline, I understand that, but most people should be able to increase their activity a little bit more. I'm starting to do a little more weightlifting, focusing on muscles that support my back, while at the same time not, doing too much where I'm hurting myself. So that's where I'm at as far as getting through months 1 through 6. Those were the important things for me. Things I've done since my surgery, I think it's important to talk about these things because I know that I had zero hope before my surgery. I didn't think I was going to be able to travel. I didn't even really know if I was going to be able to walk that well. was in a dark place before surgery. So I think it's important to just talk about a few things that I've done since surgery. I've gone to many concerts. I've found myself in the middle of a few mosh pits, and to think that was going to be happening 5 or 6 months ago, I can't even really picture it. But I've traveled quite a bit. You know, I've taken the 5-hour train rides. I've taken 3-hour flights. I've taken car rides. That was a big concern. I didn't know if I was going to be able to travel for a while. I've done some crazy photography excursions out on frozen Lake Michigan, walking on ice and put myself in less than ideal situations for someone that just had back surgery. But I think part of my recovery was doing those things again and knowing that I could. I just got home from a 5-day trade show for my company, and I'm on my feet for 9 hours a day talking to people, setting up my booth, and all these activities that take a lot of back strength and just standing for hours and hours. So before I had surgery, I had to cancel a trade show because I couldn't do it. So it was a really big step to do that trade show for me. Things I hope to do next, I'm not quite ready for, but hopefully in the next 2 or 3 months are to join my softball team again and just increase my workout quite a bit. Right now I'm not lifting too much in terms of weight. I'm doing a lot of stretching and simple back strengthening type things. I want to change that. I want to get back to building up muscle, and that's the type of workout that I was doing before. That's the type of thing I enjoy. So I hope to get there in the next 2 or 3 months as well. Just some things that I still feel since surgery. I'm still sore in the morning. I take an ibuprofen, maybe 2 a day, 200 milligrams, especially, in the morning after a later night, I'll be a little sore. I still feel the numbness in my foot, particularly my left foot, and that's just part of it, I think. Those nerves take a long time to recover. So I'm being patient with that. Occasionally I'll feel little bouts of sciatica kind of in my leg and my hip and butt, but I'm not freaking out about it. I'm not thinking, oh boy, here we go again. I just know those nerves are tender still, even though it's been 6 months now. And it's just the patience again. That's the important thing. So that's my update. At 6 months, went a little bit longer than I had hoped, but I'm just here to be hopeful for you. I know that I was in a dark place 6 months ago, 7 months ago, and I promised I'd make these videos. Just to give a little bit of hope to people going through the shit that I went through. So that's my update. I'm not going to do another one until 1 year. So y'all have a good summer. All right? Bye.